So this is a project I did, first project under OSN, working as a data analyst. And this project basically involves performing analysis on over 50 states in the United States, um, and focusing on hospitals, DRG, which is basically a group related ailments in the United States of America, and basically talked about the different charges involved in each DRG, the states involved, the providers involved, which is the healthcare providers, um, and also the cities as well, and also the number of discharges that each of these providers um, have performed over a certain period of time. And yeah, so basically this introduction is a data set of 150,000 records. It focuses on the United States of America. Over Looks at over 50 states in the USA, and this data set had 12 features, which included the DRG definition, the states, the cities, the discharge count, the average cover charges, average total payments, and average Medicare payments as well. And this survey involved more than 3,000 healthcare providers within the United States. And then so basically these are the descriptions of the features. Um, and if you have a glance through, you'll be able to see the meaning of these definitions. I felt it was very important to explain what the features are in the data set, so it's to give you a better understanding of what the data set is about, especially if you are not used to that kind of data set. And so basically my business problem was to look at the data with from a holistic approach, to gain insight into the healthcare providers based on each state, to check out which would be the cheapest, also the most affordable, and also with the ones that have the highest discharge rates, and also the DRG that had the highest discharge rates. And basically this should just show which DRG were which DRGs were easier to treat, and which hospitals were more equipped to treat those DRGs. And also at the same time, I also focused on looking at Medicare, because if you understand what Medicare plan is in the United States, it's for people age 65 and above. And basically, if a state has a higher Medicare cover cost, that just indicates that that state has a higher elderly population. And during this course of this project, we'll be able to see which states that was. And yeah, so basically, yeah, so this was the very first analysis I did, which was to check the state with the highest Medicare payment. And the state with the highest Medicare payment was California. And we just basically showed that California had more elderly people. And it's no surprise, because California is the most populated state in the United States. So there's a strong correlation between the population and also the elderly people within the states, and also the amount of Medicare payments that will be made. And you can see from the graph, it is way above the rest. So it's quite a lot of payments being covered in California. So I believe that this will help the United States government be able to allocate budgets when it comes to health budgets, and be able to know that the California will definitely need a bigger share of that budget. And the next was New York. And so yeah, basically just be able to give insight into that. And then I was very concerned about checking which DRG was the cheapest. And from determining that, I could see that chest pain actually had the cheapest average covered charges. And basically average cover charges are just also insurance or third party providers or companies that help to take care of cost of patients. And so the patients have nothing to do with these charges. The third party or the insurance company covers these charges. And you can see that the lowest was chest pain. So insurance companies are willing to, just so that insurance companies will be more willing to cover up for charges related to chest pain, because it's quite affordable. And then yeah, so I just decided to also do a list of the cheapest DRGs across um, across the states, and this graph just basically shows um, the cheapest DRGs across each of the states after summing them up. And then I was also very interested in seeing the maximum discharges of DRG. So which DRG had the most discharges. So it just basically will show which DRG is easier to treat. And after performing this analysis, I discovered that major joint replacement was one of the DRG that how the high discharge is, and there could be a lot of factors involved. It could be that there are a lot of people in America that do need joint replacements that are involved in those kind of surgeries, and yeah, so there are so many factors that will be able to determine why that is so. But basically, that is the major um, that's the highest discharges that the data set provided, and this will help insurance company know which of the DRGs they should put more money into and focus on. And then so after that, then I did a comparison between total payments and the average medical and Medicare and medical payments, rather Medicare payments. So basically, this first of all, total payments is just an inclusion of the Medicare payments and the personal money that the patients would pay. And so I was trying to look at how many um, or how much Medicare is willing to cover for patients. And obviously, as you know, those patients have to be 65 and above. And from the graph, you can actually see that there is a very close amount being spent between total payments and Medicare payments, which gives insights that most people that are visiting these hospitals are elderly people, and that's where Medicare payments are covering a lot of this cost, because that is what Medicare payments are for. And then also I was very interested in seeing the top 15 discharges by state. So I wanted to know which states had the most discharges. And then again, we could see that California was topping the charts. And this is no surprise because, like I said earlier before, California is the highest, is the most populated state in the United States. So yes, obviously they will have more discharges within that state. So basically, this pie chart was just able to give a very first glance look at what is going on. We could see Texas coming in second, and then we could see New York. We could also see Florida as well. And then so I was really interested in narrowing down total payments. So I wanted to know the lowest total payments in per states, and not just states, and also narrowing down to the cities as well. So I was able to create a graph that not just provided the total payments for the states, but also narrowed it down to each cities. And you can see that one of the states with the lowest total payments, it's the states with the WY code, and you can see cities within those states like Rock Springs, Evanston had really low total payments rates, which just shows that those states and those cities do not really have a lot of patients that they need to cover their charges for. So insurance company doesn't really need to bother about allocating so much money to those states, because there's a very huge possibility that those states will have very low populations, or very low elderly populations as well. And then yeah, so I was also then interested in seeing care providers, like number of care providers within each state. And then this was also very interesting as well, because it was able to create a strong correlation between the number of care providers that would be created in a state, and also um, the number of discharges in that state, and then also in the larger extension or further extension, also explain the population of that state. And once again, California is topping the chart. So California has more healthcare providers, and it's no surprise because more healthcare organizations need to be created in California in order to cater for the population, the elderly population, the general population, and which also enables it to have more discharges and to be able to have the facilities to cater for its people. And yeah, so basically that was what I did. And then based on all the insights that I got, it's quite clear that Excel is a very powerful tool for data exploration, data analysis, and also for data visualization as well. It's a tool that that easily is able to perform all these operations in, yeah, in a simple package, and with just one single tool that's able to perform all these operations, and be able to store your data, organize your data properly, clean your data, visualize your data, perform analysis, perform functions on your data, and yeah, get insights from those data. And then yeah, so like I said earlier, so there was a clear correlation created that can help people understand where to find states with more providers, which was California, and states with most affordable treatments, which was WY in the United States of America.